Introducing genicular artery embolization, a non-surgical process to treat the pain of knee osteoarthritis. This animation demonstrates how this procedure is carried out step by step through the foot area. Procedure through foot, Dorsalis Pedis Artery. Firstly, the skin around the foot is marked based on the upper and lower margins of Dorsalis Pedis Artery. Then the location of Dorsalis Pedis Artery is picked up using ultrasound. The skin entry site is numbed by injecting lidocaine. The Dorsalis Pedis Artery is accessed via ultrasound guidance using a micropuncture needle. Once the blood return is noted, a micro wire is advanced through the needle into the Dorsalis Pedis Artery. The needle is exchanged for a transitional sheath, which is advanced over the micro wire. The micro wire and dilator of transitional sheath is replaced with a wire of larger diameter, which is advanced through transitional sheath into the artery. The transitional sheath is replaced with vascular sheath. The dilator of vascular sheath is removed. The sheath is aspirated using heparinized saline solution. An angial catheter is advanced over the wire through the sheath. An angiogram is performed to locate the genicular arteries contributing to inflammation of knee joint by injecting a contrast dye to visualize blood vessels. For patients suffering from kidney disease, carbon dioxide is used instead of regular dye to avoid kidney damage associated with iodine contrast. The wire is advanced to select the target genicular arteries, and microbeads are introduced to the area. Microbeads are loaded with anti-inflammatory drug that halts the inflammation and completely resolve the pain.